Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. Earlier this month, we talked with Janet Lau, an integrative registered dietitian who introduced us to mindful eating. That's the practice of slowing down and focusing on the hows and whys of eating. In our April Keynote, Janet talks to us about the tools she uses to support her patients and empower them to feel confident in their new, healthier behaviors. Okay, so someone comes to you and says, I have terrible eating habits. I want to feel better. I want to change the way I eat. How do you help them get started on a mindful eating plan?
So it's really about getting an understanding of the patient, where they're at, their eating and lifestyle factors. And that requires a number of questions that we ask the patient. And some of these questions require more prompting, so I get a better understanding of what we need to work on. And throughout that process, it's very conversational. It's pretty much a dialogue. And what we end up with is giving them pillars to strategize moving forward, right, to meet their health objectives and to maybe improve their relationship with food. So we talk about hydration, how to eat, when to eat, what to eat, how much of that to eat, and then we talk about physical activity. And that's really dialogue because we want to make sure it's realistic, actionable, and sustainable. So we want to make sure that they can do these strategies. And on the follow-ups or all their returning touch points, we inquire, how did it work? What do we need to work on? What were some distractions in the way? And, there's plenty to uncover and unlayer throughout the process. But that's the basics for the most part.
Mm-hmm. And that's where the food journal would come in, that they would come back with concrete evidence of, here's what I did.
Right.
Mm-hmm.
I offer the food journaling experience because I think it gives both of us a lens of what's really happening. And I also want to make sure what I'm saying is aligned, right, and not misinterpreted. And yeah, that's one of the tools we use. But our conversation can go in so many different directions when it gets to the follow-up.
It sounds like you really listen to the person. A patient coming in will really feel heard.
Listening is so key, active listening for sure, because sometimes they share things with me and I'm hearing something else that needs to get worked on. Mm-hmm. I could give you an example.
Sure.
A patient was sharing with me that they were eating whatever and then they were feeling bad about it and they weren't sure about something and they were using a lot of language like that. They weren't necessarily following the strategies, but kind of. So they were not confident. And then, so we zoomed in on that. What's that about? I want to make sure I'm understanding you clearly. And that's when they pause and say, well, yeah, I have been noticing a lot of pauses here. It's because I don't feel confident in my choices. And then I just don't know if I'm doing it right in the end. And that's a great point because now we can share, okay, how can I support you in feeling more confident? And then we start working on those cues that could help them make better choices so they don't have that guilt. Because we tend to go back and forth with our choices, like, are we doing this right? So in Nutrition Custom Care, we're aiming to help them feel more confident about their food choices, their food behaviors moving forward.
That's great. And it all starts with a conversation. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.